So what is subluxation, and could that be the very thing that's causing your lower back pain? Hey, I'm Dr. Aaron Wall with Gateway Chiropractic in Fort Worth, Texas. Could subluxation be causing the lower back pain that you're dealing with? Well, let me explain. If you don't know what that term means, I want to start with how your spine should be aligned. A lot of people don't know what normal is. There's a normal alignment to you and me. If you're looking at us from the front, our spine should be straight up and down. Our hips should be level. I think a lot of people, kind of assume that. We've heard that before. But here's what's interesting. From the side, you should have a 45-degree curve in your lower back. And a lot of people don't understand that. So when you have the curve, when you're straight from behind, all these holes are open for your nerves to run your muscles. These are sciatic nerves, so they run your legs as well. Your discs stay healthy, your bones stay healthy. These nerves run a lot of organs as well, like the digestive tract or your bladder or reproductive organs. So a lot of hormone stuff that happens from these nerves as well. So if you're in the right alignment, your body works well. You're not going to have things like lower back pain or sciatic pain down the legs. But I want to show you something. If your spine, if it shifts out of its normal position, you can see right there, and it gets stuck like that, that's called subluxation. Now, subluxation is when a vertebra above and below gets stuck out of alignment, and the nerve that it's supposed to be protecting, it just gets compressed. And this doesn't just happen in one area. Like, you can, due to a million different reasons, like traumas, falls, sports, injuries, people assume like that, like an auto accident. But I'm talking about, like, if you sit at a desk all day, every day for hours, that can really destroy your back, the curvature and the posture of it, the alignment over time. So your spine can start to lose, like you can lose, all the bones can get out of alignment from the side, or your spine can start really bending. You've heard of scoliosis, but it starts bending one direction. Well, you can see the nerves here are getting subluxated, they're getting compressed. This could be the reason that you're dealing with lower back pain. And so a lot of people don't understand that's where that comes from. But also, how do you correct it? How do you find that out? Number one, well, obviously testing is important. In our office, we do a series of tests. This can affect your range of motion. That's a big sign. If you are not moving very good, if you're very stiff in your back, could be a sign that you have subluxated it. Another thing would be if you're having a lot of pain in your lower back or even down the legs, numbness down the legs, weakness in your legs. Typically that's coming from the lower back. A lot of people don't understand that either. But then also, we do thermography. So when nerves are damaged, they get hot. So we can scan the lower back, and it emits heat if these nerves are inflamed because they're subluxated. And then obviously we do x-rays to see what's causing that to happen, so we can help somebody like you that has lower back pain actually get better. So I want to demonstrate, when you do have a subluxation, how would we actually help as a chiropractic office, help align the spine and get you healing better. So I want to demonstrate this. We have Markia, who's been so helpful to help demonstrate this. And this is actually, what I'm adjusting with her is her lower back, but it's based on her x-rays, her testing. So this is specific to her. But I want to show you a couple of ways that we adjust the lower back. The first one is we use gravity drops. This table comes up super easy and it drops down. This helps align the spine, but it's a very gentle way to align it. So if we have a lot of children, or if we have some elderly patients that maybe are a little bit reserved from a manual adjustment, this works great. So we just take the hips up and then we line them back into place. It's a little noisy because it's a drop table, but it's actually very gentle. And it just lines the hip right back up. Another one that we do, we use this machine. It's called an Arthro gun. It's an adjusting instrument, so we can do this as well. But I'm going to work her hips some more. And so this goes past the soft tissue or the muscles right to the hip joint itself. And so it gets a lot of movement because it can kind of sneak past if you have tight muscles, this is really good to kind of get through there and help things move. Do a little bit of her sacrum as well. And then I'm going to do two things for the hips, the lower back here, but these are going to be a little bit more of a manual adjustment. So this is going to be one area, and so Marquis, I'm going to have you lay on your side, this side up facing me. Perfect. And we'll get you lined up here. We'll get you lined up. Bingo, perfect. And we'll just kind of roll you over here. There you go. Nice. And I'll have you sit up and we'll face this computer. So that's more of a manual adjustment. It clears everything in the lower back, the hips. It just takes a lot of pressure off. And then what we also do for this curve that she needs some work with is we're doing arthro stemming here, and we're putting this curve back into her lower back. Excellent job. And so those are a couple different tools we use to adjust a patient's lower back. There's some other ones that we can do as well, but also something that we do in our office that's very unique to us. We do a lot of therapy, a lot of muscle building, rehab, because we want the corrections we do to last. And so we have to build up those muscles to support what we did. So hopefully that answers some questions as to how we can help you if you have lower back pain. But if what we're saying makes sense, you want to come check us out, see how we can help you. There's a schedule my appointment link next to this video. Check on that, and we'll see you in the next video.